All right, it's officially 3, so we'll go ahead and get started. Hello, my name is Maria Reguin, and I work for Student Health Services as a peer. I want to take a second to thank you all for joining us today. A few things before we get started. We will also be taking questions during the webinar, so you can go ahead and submit your questions by directly clicking on the Q&A button. Jean Erlenburn will be monitoring the questions as they come in, and will be responding to some in text. But for the most part, we will try and answer all of them live. The goal of this webinar is to address physical and mental health questions, concerns, and how to stay healthy during this pandemic. With that being said, I have the pleasure of hosting Bert Epstein, SRJC psychologist, and Cynthia Dickinson, our SRJC nurse practitioner. Thank you both for being here today, and let's go ahead and get started. All right, Bert, can you go ahead and tell me a little bit about yourself and what made you want to work in the field that you are currently working in?
Noticing that I was muted. Okay, there we go. Sure, I'm happy to do that. Thank you. Yeah, and welcome to everybody who has tuned in. I've been in the field of college counseling for about 25 years now. And really, it was when I was in graduate school that we were exposed to a wide range of different kinds of work that we could do. And one included college counseling, and I gravitated towards it and loved it. And I've been at a number of different colleges ever since then, and now at the JC for 10 years. So it's wonderful here. I really enjoy working here and meeting the needs of the students.
Thank you. And Cindy, same question. Can you tell me a little bit about yourself and what made you want to work in the field that you are currently working in?
Thanks, Maria. Yeah, I'm really glad that people have joined us. And I'm a family practice nurse practitioner. And what that means is I'm a registered nurse who's gone on to study more to become someone who can diagnose and treat conditions. And when I graduated from nursing school, I did some work in cardiac care, which I was really drawn to. And what I found was that people were suffering quite a bit from conditions that really could have been prevented through healthier lifestyle. So I wanted to go back to school to become a nurse practitioner, to learn how to teach others how to eat better, exercise, do the things that'll help prevent heart disease later in life. And I've worked in community clinics for about 30 years. I was drawn a lot to doing reproductive health services, preventing unwanted pregnancy, and also got interested in this college nurse practitioner role, and I've been doing that for about 6 years. I really enjoy the students and helping them stay healthy and meet their goals, meet their scholastic goals and their life goals. It's been really very, very fun for me. And the last 3 weeks we've been doing the telehealth way of doing visits in the student health services, and that's been really good way to connect with students.
Oh, it's so good to hear that. Moving on, next question is, what are the most frequent concerns that you are hearing from students about COVID right now? So we're gonna go to Bert and then Cindy.
Okay, sure. Well, I guess I feel like students are dealing with a lot of challenging issues right now. There's so many different aspects that probably come into play. Clearly being home all of the time is a huge issue for students, and when you're home all of the time, for some students that home environment is not a great one to be in, and that in and of itself can be an issue. So we're hearing some about that. For other students, they're mostly by themselves or in a situation where they need to be by themselves. And so there's a sense of isolation. We're hearing from some students that they are using substances more. And some are okay with that, and some are finding that that is getting to be a problem for them. A lot of students are talking to us about time management issues and how that's really been hard in this transition, that they're going to school and attending class, but it's not the same as it used to be when they would come onto campus and go to classes and had a routine. And now everything has changed. I think it's true probably for most people that time management has become something to deal with. Social interaction is, of course, changed so much with the shelter in place and people's routines that they had before of going out and whether it was just to go to a restaurant, a friend's house, anything, getting together with people, that's been so disrupted, and so many students appreciate that so much and having the opportunity. So when that's taken away, that's hard. And students are talking to us about that. Of course, we have the video teleconference, which we encourage, but it's not the same. There's restrictions. People struggle with, food is different with grocery shopping, exercise. There's certain limitations on that given the county, regulations. Doing everything by Zoom. So there are different expressions, but Zoom fatigue for some. If you're so many classes by Zoom and talking to other people and just staring at your computer screen, which we're on one now, but that can be challenging for people as well. And coping with illness, if they do have their own illness or an illness of others, that's hard. And finally, the news. That there's this one big news story and it seems to be everywhere on social media and regular media and what people are talking about, and it's hard to get away with. So I think there's probably some I'm leaving out, but those are some of the biggest challenges and areas that students are coming in and talking to us about in student psychological services.
Okay, Cindy, what about you on your end? Anything specific that you would like to add?
I think many of the things that Bert touched on, we've had a number of students call who are, feeling stressed, feeling depressed, more isolated than usual, needing refills of their medication. Students who are feeling, wondering if maybe they have COVID, they're having some symptoms, they're not sure, if what they're having is related to an infection or is it something else, is it allergies or is it a cold? And how to get a COVID test, they want to know that. If they can get birth control refills, if they can, find a doctor in the area. Those are some of the things we've been working with, asthma, labyrinthitis. Some people have, just usual new symptom onset, just trying to help students make sure that they're not having anything serious, that, we can help them, assist them get to their regular provider in a timely way. We're helping to facilitate that. So far, follow up on concussion, we've done a little of that. Haven't had any new fractures that I know of, but those are the things that we've been doing. Are you know, mostly what we usually do, but a little bit less volume right now. I don't know that students know they can call us right now. So that's part of why we're doing this workshop, is so that they know that we can do a good workup over the Zoom or over the phone, and help them figure out next steps.
Thank you, Cindy. Okay, so a question for you, Bert. Can you tell us about what kind of therapy is offered at SRJC and briefly describe what each is?
Sure. Well, we see students for a lot of different issues. The top 3 issues that students will come in for, and this is just in general, are issues related to mood. So some people would call that depression. Issues related to anxiety, and some people would call that stress, and then issues related to relationships. And there are, you know, that could be romantic relationships, a roommate relationship, or a family relationship. So I don't know that that's changed really. And, you know, in the first question that you asked me, I rattled off a number of very specific issues to the pandemic that people are talking about, but in so many cases now, those are just layered on top of what someone's already struggling with. So we have people that are coming in to talk about, you know, let's say they're struggling with anxiety, like just a lot of worry, maybe not even necessarily related to the pandemic. That could be a part of it, but we're hearing about other things. We're hearing about students who are transferring to a 4-year school and they're wondering how things are going to happen with that, or maybe even it's not necessarily related to the pandemic. It's just, hey, am I going to get into this school? So there's so many different kinds of things that students come in and talk to us about. And I guess a key point that I'd like to make is, I think many times students feel like the issue that they need to have in order to come and talk with one of our therapists in student health services, it needs to be a very extreme issue. You know, they need to be in crisis. They need to feel like everything is completely wrong. And I just want to let everyone know that, you know, we talk about roommate issues. We talk about people who are struggling academically and what this means to them. Friendship issues. There are issues that people might not look at and say, oh yes, it's not the end of the world. But we are happy to help people with that. And I saw a note on here from one of our behind the scenes folks that we have a slide actually on how to make a mental health appointment. And maybe we could show that slide to folks just so people who are watching this do get a chance to see that. So we have a few people that are, I think, behind the scenes here that are working on that. Okay, so something's coming now. There it is. Right. So as you can see on here, if you're interested in a mental health appointment, the slide here talks about the ways that, you know, you could do that. You can simply call our phone number, 527-4445. It's the same phone number for mental health and physical health. But you can call that number or email studenthealthservices@santarosa.edu. And we're open most hours during the week. And it talks also on this slide about many of the different kinds of things. It kind of answers your question further, Maria. Many of the different kinds of things that we talk about, you know, that are on here. Some that are related to COVID and some that are not. So this is just a little bit of information for people. Oh, I guess it does mention too that we are doing a secure video conference for people right now, and that can be by phone or video. A little bit similar to this, and it is secure. And the students that we talk to will find a space where they can talk privately. For some of them, it means getting in their car. If there's no space at home. For someone else, it means taking a walk down the street and going to a different, spot. But that's how we've been doing it, and it's been working out.
Perfect. Thank you so much. And Cindy, another question for you would be, how do I know if I have COVID-19, and what can I do to actually get a test? You're
unmuting. Yes, thank you. So how do I know if I have COVID-19? So COVID-19, the most common symptoms are the fever, usually over 100, body aches and fatigue, cough, shortness of breath, a loss of sense of taste or smell. It's right now, the flu season's pretty well gone. So if you're having a fever associated with a cough or this fatigue, that's pretty suspicious. And so that would be kind of a sign to call. Now, each person is going to have a different manifestation of this this particular virus. What we're finding is it goes from anywhere from no symptoms at all to very severe shortness of breath, difficulty breathing, and needing to be hospitalized and even intubated to be assisted to breathe. So it really varies from person to person, but the best thing is to notice if you get a fever, chills, fatigue, to call us or call your doctor. And then your second question about how to get a test. The good news is the county just got 10,000 new tests from Amazon, of all places, but they got them, so that's great. So their goal is to do 200 tests a day. Call your provider, your medical provider, if you need a test, if you think you'd like a test. And they can, each practice has a protocol around, what the criteria is and how to get a test. Now, if you don't have a regular provider, we can help you with that. So call us, the 527-4445, and we can help you identify the best place to go for testing or to establish care to get a test.
Maria, I just noticed as Cindy was talking that there are a bunch of participants on, and just in case people came in after the beginning, can you let them know if they have any questions, how they can ask during this live webinar?
Yeah, so yes, so we are actually taking questions live right now. If you look down below, you should be able to see a Q&A button. You can directly type in your questions there, and Jean will be monitoring the questions as they come in. She will also be responding to some in text, but our goal is to ultimately answer all these questions during the live webinar. Okay, so on to you, Bert. What are some ways we can battle depression, depressive thoughts during COVID-19?
Yeah, so I think people do have a lot of struggle, certainly, during COVID. And as you point out, for some, it takes the form of feeling down, kind of depressed. I think for some, it takes the form of feeling anxious and worried. And I have this view that that depression and anxiety are kind of linked. while they are separate, they share traits with one another. And that what you can do about one will help you with the other. So the kind of suggestions that I like to give to people often work for both, which is actually kind of cool, because then, you know, we can just give these suggestions and they tend to work. So some of the things that I would talk about in terms of helping if you're feeling more on the depressed side or more on the anxious side are that it's easy to, in our remote world, to kind of slip into, you could say, bad habits. You know, maybe not get dressed, or, you know, throw on a t-shirt, but, you know, not much, you know, everything else you're not doing as you usually would, or you don't take a shower, or you don't, you know, follow your routines and so on. And so I encourage people to, you know, get dressed, for example, as if you were going to be going out and doing other things, taking a shower, doing all your usual routine stuff. And I think that that's helpful for people. Similarly, exercise. And I know some exercise, like, you know, gyms are closed, and some, you know, parks and like that. You know, if that's your thing, it's not going to work in the same sort of way, and you might need to find something different. But exercise works really well for both depression and anxiety. Getting outside, just sunlight, and it has lately been sunny, so sunlight is something that helps. And again, I know there's some restrictions about where we can go, but just getting out some is something that can be useful for people. Taking breaks, so if you're just, you know, doing, whether it's studying or what, you know, something, but just taking breaks is usually really helpful also. I suggest limiting the amount of time that you spend on any kind of media, you know, watching the news. While it's good to stay informed some, it's really easy during these times to get kind of take it in and, you know, watch a lot of news, or you know, social media, however you get your news, and just be absorbed by it so much that I think that can make us feel depressed or make us feel anxious. So while I encourage people to do that a little bit, you know, maybe check in once a day on something to restrict that some. Eating would be another area in terms of trying to, you know, eat similar to how you did before, not too much, not too little, nutritiously. Sleeping well, trying to keep to a good sleep schedule. Having fun, which, you know, maybe people would say, well, what are you talking about? It's not a fun time. But, you know, if you can build in some pleasurable activities, I think that generally helps people. And so you might need to look to find something, because our routines are different, and where we are and where we are allowed to be is different. And so if your favorite thing in the past was doing something, you know, at the beach, and you can't be at the beach right now, okay, so then you need to find, you know, something different. Some people are using this opportunity to learn a new skill, do something different, taking up something that they weren't doing before, and maybe setting a goal with that. And that's something that I think also can be helpful. Some folks get into catastrophic thinking. I think that's really easy to do with COVID. And like Cindy was talking before about, you know, some of the worse effects that this can have on our bodies. And so people can go down that line of worrying about that. And even from like, oh, I just sneezed, so, oh no, maybe now I have COVID. And so, you know, working mentally with yourself to kind of fight against that kind of thinking with more accurate thoughts. And finally, I would just sort of say that really accepting that we are going to, during these times, going to be feeling anxious and depressed and so on at times, and saying, you know, that's normal. That that all of us are feeling that way at times, and it's okay. And then working to do some of these things so that we can try to feel as good as we can.
Thank you, Bert.
Mm-hmm.
I have a whole bunch of questions about masks, so I'm gonna lay them out for you. The first one is, do we have to wear a mask outside when we go on a walk or are working out? I know that's a little bit difficult when it comes to like breathing or if you already have breathing challenges. So I wanted to get your take on that.
Well, I think it might be best to talk a little bit first about how we prevent, COVID infection in general, and then narrow down on the masks, because masks are just one small piece of it. The most important things are the two: washing of the hands, 20 seconds. I know it's really easy to skip this one because it's okay. We already know this one. Wash your hands, 20 seconds, warm water, nice soap. But that's number one. Number two is the physical distancing. 6 feet from somebody who is not part of your household. Okay, so your household are the people you live with, right? So say you got a best bud, but they're not part of your household. You need to keep 6 feet from that person. And I know that's really hard because they're somebody you wanna get closer to, you wanna get in their car, go on a ride with, but that means that anybody they've been in contact with, now your household has been in contact with. And plus anybody they've been in contact with have people they're in contact with. So you see, it's kind of exponential. And so that's why we need to keep 6 feet from anybody outside of our home. So that's where the masks come in, is that when we go out into the world, away from our homes, we need to get into situations for essential services like doing groceries, where we may be closer than 6 feet to other people. And so that's when the masks come in. So that's why now when you go into the grocery store, they're going to want to see you having a mask on, and you'll notice that those workers are wearing masks as well. And also, if you're walking outside in your neighborhood and it's unlikely that you come within 6 feet of a neighbor, it's fine not to put your mask on. Although I bring mine with me, because what happens is I do a lot of trail walking, and I notice people come pretty close. That's not really a 6 foot distance. And they're running. They may be running, and they're exhaling really hard, and they don't have a mask on. So they're putting out virus. Now, this mask I have on really isn't about protecting me. It's about, if I have the virus and I don't know it, I'm trying not to spread that to other people and the people in their household. It's more of a prevention for me to not spread it. But that's my understanding of the use of the mask in the situation where we want to use the mask. The reason why they didn't initially encourage us to use masks were a couple of different reasons, but one of the most important ones was that we didn't have enough stock of the N95 masks that our healthcare workers need to have when they're in clinical situations with people who we know have the COVID-19. And we want to keep those masks for them. So what we wear when we're out and about is a different kind of mask. And so the CDC has on their website, and you may have even seen on Stephen Colbert show, whatever, how to make a mask out of a bandana. There's all kinds of ways to make masks. But the big idea is, multiple layer of cloth. You can, or you don't have to, but you could put a paper filter in there, like a coffee filter that then you discard later. So the idea being that enough of a protection so that if you're exhaling virus, it doesn't get to anybody. If you get short of breath using a mask, you shouldn't be wearing one. That means you should probably just be walking in your neighborhood in an area where you're not going to encounter people, and you should probably not need to be doing your groceries on your own. Somebody should be doing groceries for you if you're not well enough to wear a mask. Does that answer that one?
Yeah, that's actually quite perfect. Just one more, because a lot of people have the hospital kind of masks. So the question is, how long can we use that particular face mask before getting a new one?
Right. So those paper, what we call procedure masks, you could use one of those for a day.
For a day?
Yeah.
Thank you. Okay. And looks like we have somebody asking, Cindy and Bert, do you have any suggestions for preventative health measures to practice and to try and stay healthy as much as possible during the sheltering in place? I don't know if Bert, you want to go first?
Well, from a mental health perspective, it would probably be a lot of the kinds of things that I had talked about. The sort of ways to keep your stress level down that I talked about, ways to keep your mood increased. Oh, here's one that I didn't mention before. This is kind of interesting. There was a recent study, and it compared people, it looked at depression, and it compared people who would take a bath. Like, they randomly assigned people to either take a bath or to do a moderate amount of exercise several times a week in each case. And what they found, this was really surprising to me. Now, it was just one study. It was fairly small. So anyway, but what they found in this study was that the people who were taking a bath, actually their moods were better than the people who were exercising. And I thought that was very interesting. And then there's all sorts of ideas about, well, what taking a bath does for you. But anyway, that's just like a little trick. And anyway, something that people might think about doing, just as, if you got a bathtub and nobody else is using it, probably good for stress and all sorts of other physiological effects too. So those are a few things I can mention.
Cindy?
Yeah, well, thanks, Maria. I think that's an excellent question. In terms of prevention, I think sleep, I think of sleep as one of the core issues for students, for humans, it's, and what happens, I think, as Bert had referred to, is when our structures shift and they're not there as much, our sleep goes off. And then if we don't get up at the same time every day and don't go to bed at the same time every day, we tend to kind of get a little disoriented in our lives. We lose a bit of our roots. And so it's really nice if we can do that for ourselves, create that pattern of going to sleep at the same time, getting up at the same time. Now, some people have a very different sleep pattern, and it would work for them to stay up very late and get up very late. And if that's okay and it's not impacting their their school or their relationships, then that's okay. But for most people, they have school classes during the day that they have to show up to, and so they have to really actually, go to bed at night, get up in the morning early enough, to get their shower in and their breakfast in before they get to their class, even if it's an online class. So that, I think sleep is important. I think, if you can take just 3 minutes to sit and be mindful, just sit and take a deep breath and follow it and just be present for that one moment. However you practice mindfulness, spending a time with that. And then I've found that just a little bit of yoga every day, if I can break up my day and not sit in the same chair hour after hour, that's so important. And do some stretching in between. However you can structure that for yourself. Those are 3 things I'd really, if people might pick one of those to practice and try to work into their habits.
And if I could add on to the sleep, we do get people coming in for therapy and talking about sleep being an issue for them. And especially lately, people will sometimes say, yeah, I'm distracted during the day, but then I go to bed at night, I get ready for sleep. Now I start thinking about lots of stuff, and then I can't go to sleep. So there's a few additional things that I would suggest that can be helpful for sleep. One is, if you're a person who uses caffeine in any of the different forms that it can come in, is if you're having trouble with sleep, try to cut back on that, move it as early in the morning as possible, or don't even have any caffeine at all, and see if that helps with your sleep. If you're doing exercise, don't do it within about 4 or 5 hours of sleep, although doing some exercise is good for sleep, just not too late in the day. Also, since we're so connected with our screens these days, being at home, whether it's a computer screen or TV or something in that blue light, if you're doing that right before you go to bed, or phones also, if you're doing that right before you go to bed, that that can interfere. And so that may be something to try to change up, and doing something just relaxing and getting into a routine before you go to bed. So you say, okay, like maybe an hour before I go to bed, I'm going to do this for 20 minutes. And then the next 15 minutes is, and then you do that same kind of thing every single day, so that by the time you get into bed, your body is kind of like, oh yeah, okay, I'm ready to go to sleep. You condition yourself, essentially.
Thank you. Cindy, should we disinfect our groceries or anything we buy in a can or box when we go shopping? There's a lot of mixed reports around that. Also, takeout boxes, do we want to disinfect that too?
Right, definitely lots of mixed information about that. It's probably the least likely way that you will come in contact with the virus, because there'd be such a small amount of virus on it in terms of infecting yourself. And so, but one can reduce the risk by, when you bring in your groceries to your house, washing off vegetables, wiping down cans and boxes, putting them away, and then of course washing your hands afterwards. Also, when you get takeout food, people like to get the food, put it on another plate, take the boxes and bags and whatever and put those in the garbage. Don't touch your face, wash your hands carefully, and then eat it. Should be fine. The food is, we don't worry so much about the food, is not a way that people are transmitting it. And then disinfecting surfaces, probably once or twice a day. Good idea, especially if you're bringing things in from the outside with a disinfectant, is a good idea. But a low risk area, something that, it's okay to spend some time paying attention to it, but it's not a big risk area.
Thank you. Bert, what are some practices if we're having trouble staying motivated and dealing with time management?
Sure. Yeah. I think people are struggling with motivation. And one of the things that I've seen people talking about is that they have more time than they're used to. So in the past, they needed to drive places. And now, well, for many people, we're not driving places. So we have more time. And we used to go places to socially, but we're not doing that. So we have more time. So all of this time is adding up. And you would think, well, gee, if you have lots of time, then that shouldn't be too much of a problem to get done the things that you need to. But there's this weird effect, and this has happened for a very long time, that when people have more time, it actually can be harder to do the kinds of things that you need to do. For example, there's been studies with college students as to if, not considering financial need, but just how many hours of work is the ideal number to get the best grades. And you might think that it would be zero, if I didn't have to work at all, well then, I would get the best grades because I'd have all this time. But it's actually not. The studies have shown that people who work, I think it's 10 to 15 hours a week, have better grades than people who don't. And that's because their time gets more restricted. And so they have to make a schedule and they have to say, okay, this is when I'm going to be doing the studies and, stuff that you need to do for class. So this is similar because now we have more time, I think people start to get into habits of, oh, well, I have lots of time, so I'm going to go watch Netflix. And that might be fine to do in the evening, but then you struggle with motivation. And our routines are off. We're not going to the places where we would study in the past, so before I would go to the library or I'd go to Starbucks or I'd have my favorite spot and I can't go there now. Or if you're at home, well, everybody's at home now. And so now it's noisy and crowded and, like that. So there's a lot of different issues that come into play in terms of motivation and studying. And I would really recommend thinking of it as if you did have more to do. And so the best way to do that is by using time management tools and creating schedules for yourself. So you're going to say, well, okay, this is my plan. I'm going to study, read, whatever you need to do for school or anything else from this hour to this hour, and really work as hard as you can to stick to that plan. And try to be realistic. So don't say, okay, for 6 hours in a row, I'm gonna, study, because that's too much. So, break it into good sized chunks. And some people will then also use rewards for themselves to help with motivation and to stick to a certain kind of schedule. So maybe you say, all right, this is the plan. I've set it up. This is what I'm going to do. And if I can stick to this plan at the end of that time, I get to have something that you really want to have. Maybe it's something to eat or some music to listen to or something to watch or whatever. But you give yourself a treat and you make that contingent on your being able to do something that you've set up.
Okay, thank you, Cindy. Another question that just came in is, should we drink lots of fluids, including hot fluids, take vitamins, eat healthy food to help stay healthy during this pandemic? Do you have any suggestions?
Well, I think those are great suggestions around, eating well, lots of fruits and vegetables that contain a lot of healthy vitamins, full range of, your A through your E's. And because, the immunity, your immune system will be helped in terms of that will help your response to the virus. It seems that the virus really has a negative impact on people with what they call pre-existing conditions. And what that means are people who have hypertension, diabetes, who have lung disease. And so that's really unfortunate because, a lot of the people of color who are already suffering from these conditions because they haven't had as much access to health care are impacted at a disproportionate rate in terms of COVID, in terms of number of infections, number of hospitalizations, number of deaths. And so I think that's something we really have to look at in our health system. Is that health care is not equitable in terms of who gets to get it, who gets to have health care. And so we really need to do something about having insurance for all so that that doesn't happen where so many people are impacted with these chronic diseases and others do not.
Thank you, Cindy. Bert, what can I do to decrease daily panic attacks that come with severe overthinking and fear?
Yeah, so people will get into, I kind of mentioned it before, but I'll go into a little more detail. People get into what I would call catastrophizing. And that's the fear that you just mentioned, and it leads to panic attacks. So you think that something is a catastrophe, even though it's probably not. In other words, you think, oh, okay, I have a cough. I don't have any other symptoms. So you think, well, okay, for sure I know I've got, or I feel like it's likely I've got, COVID and it's going to be horrible. And then I'm going to have to go to the hospital and I'm going to die. So that might be a typical thought chain that someone might have. And perhaps the cough that they have is due to seasonal allergies or just a standard cold or, something like that. And there's so many different reasons. And really it's that process of looking for the alternate reasons. So if you notice that you're feeling anxious, you can look and say, all right, well, what was it that I was just thinking about? Oh, okay. Let's say you notice, all right, I'm feeling anxious right now. My heart is racing, I'm sweating, or I'm just, my head is telling me it's going in all different directions. I'm feeling very anxious. Okay, so what was I just thinking about? Oh, I was just thinking something like what I described. I was thinking that because I had this cough, this whole line. And then ask yourself, okay, how accurate are some of those thoughts that I was having? How accurate is it that because I have a cough, but no other symptoms, that I have COVID and then I'm going to go to the hospital and then I'm going to die. Well, you know, if you look at it that way, I think most people can go, yeah, it's pretty unlikely because it isn't even really matching up with most of the symptoms. So then you can start to go back and say, okay, I think that thinking's not accurate. And you just have to work at it like that to go, okay, it's not accurate. And then even think, well, what might be a more accurate thought? Oh, okay, the more accurate thought maybe in that particular scenario that I'm giving is, oh, I guess I just have a cough and, you know, it's just some allergies or something like that. And I don't know, that, you know, that's kind of it. You can also add some relaxation to it. Cindy was talking a little bit before about doing some relaxation, yoga, whatever works for you. There's so much stuff that you can find on the internet in terms of relaxation. And so a mixture of the mental work of looking at the thoughts that you're having and seeing if they are inaccurate, catastrophic type thoughts, and combine that with calming yourself down just physically by doing something calming, like a meditation exercise. That's a great way to deal with the panic type stuff.
Thank you, Bert. And I guess this is a question to both of you. Have you had any issues with confidentiality and asking for help if you are an undocumented student? Do we have to worry about our discussions being shared with ICE or any government agencies?
Well, I can respond in terms of our conversations on the medical side, you know, either through Zoom or on the phone around medical issues, all completely confidential, HIPAA compliant. Nobody can break into those discussions. The medical record is kept just as a part of the medical record. It's not shared with anyone else except the student, or released upon their permission to a third party. And no, ICE has not ever asked for any of that documentation. Now, there is a concern around trying to get health coverage for undocumented individuals, in that there is a program in the state to cover health services. But unfortunately, there's now, through the federal government, the public charge issue, where that the idea is that it could be held against somebody who applies for a residency. So we would have that conversation with the student about, you know, obtaining care, how their best way to get care without having that be held against them, and you know, going over the pros and cons of that.
And I guess I would just add, for the mental health profession, that we take confidentiality to be maybe more important than just about anything else. So, you know, the records that we keep are just for us and for our clinical use. And I'm not aware of there being a single instance in the entire country of any kind of medical or mental health record being used to determine a immigration status. So that isn't anything that I would let, you know, someone to feel like, oh, I can't go talk to someone because of that. And I would also say there have been some times that students have come to us and expressed that concern, and it isn't something that, oh, well, we have to document that then. You know, if someone comes and says, you know, I'm really concerned about this, do you need to document this fact, put this into your records or something? No, we don't. So, you know, just because someone comes and that happens to be their situation, it doesn't mean that it is anything that we necessarily need to record. So, yeah.
Thank you.
And if I could just add one more thing, Maria, I'm sorry, just to kind of scooch in on that, is that now is not the time to avoid getting the care that you need for something, medically or psychologically. In terms of the medical end, I think a lot of people are avoiding going to the hospitals. They're avoiding calling their doctors. They're even avoiding calling us because they think we're too busy with COVID because of all the news. And I would understand that that's why they, what they think. But really, the hospitals have plenty of capacity. If you're having, abdominal pain, for instance, that's lasting for hours and is constant, it's not going away, please call us. You need care. If that happens during the evening or on the weekend, go to an urgent care center. You may have appendicitis. You need to be seen. So don't hold off, because in Sonoma County, there are only 12 people in the hospital with COVID. I mean, across the whole county. And we're really, we have capacity. And we're starting to, as Governor Newsom today said, we're going to start scheduling in regular scheduled surgeries into the hospitals, that they've met their surge capacity, they're all set and ready to go.
Yeah, and I would echo that for mental health too. In fact, I recently talked to a student who said, yeah, I was reluctant, and this was a student who was really suffering with some significant mental health issues, but the person said, oh, well, I was reluctant to come and talk to you guys because I figured you were all, dealing with COVID stuff. And it's like, no, we have plenty of space, plenty of capacity to talk to students. We really want to help folks out. That's our job. That makes us feel good. Don't be concerned also about us, like, oh, I don't want to bother you. You've got enough going on individually. It's like, sure, but we'll feel better if we can help someone else. That's why we're in this profession. So please contact us if there's something that we can do to help you out.
Thank you. And I guess this is probably the last question we're going to do, because we are really short on time. But Bert, do you have any recommendations for how to deal with the stress, disappointments, anxiety, anger that comes from friends, family, or complete strangers not following the shelter-in-place order?
Oh. That's a good one. I have heard about that. Yeah. That's probably one of the most challenging situations that is happening right now. I think even within families, that there are people who are, people are tuning in to different news sources, they're hearing different things, they're reading different bits of information, they're coming up with ideas and saying, okay, well, so then this is how I feel I want to deal with this. And, if you take the most conservative approach, it's extremely difficult to, I guess the most extreme approach would be to pretty much just stay in your house. I'm not suggesting people do that. But if somebody said, well, I'm just going to shut myself off from the world pretty much. And, someone else might go in a completely different direction. And that is difficult when you have people within the same family or friend group, and different people are doing different things. So, I don't think there's a magic answer to that. I think communication is always the most important. To talk about, express yourself. And we talk about this range of being, you could think, I'll show with my hands, of being on one end passive, and on the other hand being aggressive. Passive is not getting your needs met and just letting other people kind of walk all over you. Aggressive is the opposite of that, is totally dominating and just taking over. And then right in the middle is this nice place which we call being assertive. And that's respecting other people's needs and interests, but also making yours known as well. And so I would really focus on communication, where you talk to other people and say, hey, I hear this is kind of what you're thinking or what you're wanting to do, but this is what I'm thinking, and this is what I would really like us to do. And is there some way that we can talk about this and work it out so that we can come to some arrangement that ideally will work out for everybody? And you might not get exactly what you want, but hopefully with communication, you'll get closer to it.
Thank you, Bert. Okay, so out of respect for everybody's time, it is now 4. So again, thank you both for being here today, and another huge thank you to everyone who stopped by. We sincerely hope that some weight was lifted off your shoulders and that you have some relief. If you have any other questions or want to reach out for support, please contact us at 707-527-4445. Visit us on online, Student Health, or you can also follow Peers on Instagram at SRJC Peers for additional resources. Thank you all once again, and have a lovely day. Bye.